when we were setting up arrangements for this, I was, initially there were like 3 people signed up, so I said, well, it's okay. I once gave a lecture to 1 person, and I'm willing to do that. But now I see all these students here, so I'm tempted to sort of turn this into a lecture on renal physiology, if you don't want to. That's the last time I got to speak to so many students, but it's wonderful to see you here. And so let me tell you a little bit about Do No Harm and how it started and what we're trying to do. Do No Harm started when I was the Associate Dean for Curriculum at Penn's Medical School. And what bothered me is what still bothers me, and what bothers me is what's being proposed. It's almost more what's being proposed than what we're living with right now. And what was being proposed was a plan to turn the medical student, not good, better, so good. And what was being planned was a proposal to turn medical students into social workers. Now, this idea that you all as medical students should spend your time thinking about population health and thinking about sort of social issues that influence health, or at least are associated with poor health in ways that we really don't understand, but nonetheless are. That was a goal that first sort of popped up after World War II, when, all these European countries were in total distress, things were really falling apart, they had no infrastructure, and thinking about how they were going to create a medical system, one of the things they decided is we shouldn't spend our money on sort of high-tech health care and worrying about treating individual patients. We should worry much more about community health and trying to create, clean water and so on, which, nobody can argue against. But the idea that if someone came in with a bad myocardial infarction and needed, an impeller pump and then needed to go in and get a heart transplant because the only way they were going to survive, that was something that just wasn't worth society spending their money on. That was a basic idea. If you go into the New England Journal this week, and there's an article in there that proposes the exact same thing. The article proposes that we're spending way too much on high-tech health. How many of you want to be orthopedic surgeons? Yeah, a few. How many of you want to be internists that are doing various procedures, GI procedures or cardiac procedures? Yeah, a bunch of you. That will be out the window. That's not what your role would be if in this mentality as physicians. Your role would be focusing on community health issues. Now, community health issues are important. They need to be focused on, but they're the job of the public health establishment. They're not the job of MDs that are using the modern technologies and modern biology that's allowing us to do things like cure 80-90% of the kids who have malignancies, for example. So I saw this coming. I saw this coming back in 2019. And the reason I saw it coming was that we had a new vice dean for education at Penn who came from another institution. And, Penn we had a good medical school. We were highly ranked. We had wonderful students, and we thought we were doing innovative things. Students wanted to come there. And she said, no, your medical school is way out of date. What we need to do is turn our students into advocates for public health issues. That really was the goal. And that still is the goal. If you go to the AAMC website, the Association of American Medical Colleges, their goal is to turn medical education into one that focuses much more on these community issues and much less on high-tech medicine, on the sort of medicine and that many of us went into medicine to practice because we wanted to treat sick people. This was our goal. Again, the goal of worrying about the community is a laudable goal. It's just, but it leaves out this whole other aspect of medical care that I think is critically important that many of you went into, certainly the individuals who come to a conference like this. So when I saw that, I decided, I need to speak out about this. And I spoke out in the Wall Street Journal with an article called Take 2 Aspirins and Call Me by My Pronouns. Now, I didn't... The article was focused on the issues I just mentioned. It made a case for focusing the medical school curriculum on high-tech medicine and on the kinds of basic science that I thought was critical that medical students are exposed to, as opposed to teaching you how to be advocates. If you want to be an advocate, you want to be for something, that's great. You're a citizen, you have a right to do that. We shouldn't waste valuable time in medical education going down that path. Now, mind you, we had a course at Penn called Doctoring. Almost all of you have such a course where you learn about communication issues and you learn about some social issues. They met, once a week for a couple hours. I thought that was plenty. Yeah, we can't ignore these. The plan was, and the plan continues to be, to expand that dramatically, as you well know. And so I spoke out about it in that article. Again, it was about curriculum. The Wall Street Journal, and any of you get to write articles for publications, they will supply the title. So they made up that title. And that title, in ways, was good because it created lots of controversy. It had nothing to do with gender. It had nothing to do, yet that's what people focused on. It got so bad on Med Twitter that 2 days later, the Wall Street, I keep saying New England Journal, the Wall Street Journal, I read New England Journal much more than I read Wall Street Journal when I was a student. The Wall Street Journal put out an editorial saying, I guess Goldfarb was right, because the uproar over this article, Penn denounced me, and it was really terrible. They wrote a piece in the Philadelphia Inquirer saying I don't represent their views of diversity, equity, and inclusion and all that. And again, it had nothing to do with any of that. It had to do with what medical school should be taught, what the focus of medical education should be. Then I wrote a book. If you come to lunch, you'll get a book free. And the book ended up having the same title because the publisher said, no, that's a snappy title. Let's use that one. So I was stuck with that. And then we decided to start Do No Harm because we felt like it wasn't enough to just talk about these things. It wasn't enough to just inform the public. We had to do stuff. So let me tell you about a little what we're trying to do with the goal of, I don't know if we're going to save American medicine. Hopefully it won't actually need saving. It'll need sort of improving. But basically, we're looking for important aspects of medical school reform that we think are crucial. And so Do No Harm has had 3 arms to its efforts. And one of the reasons I'm here and one of the things we're really hoping for is that many of the students will sign up. And I'll tell you why in a few moments, why it's so important for us to have students. So the first arm that we have is a legislative arm. And we have been involved in producing legislation throughout the country. And most recently, an example of this has been the Educate Act. I don't know if you're all familiar with this, but Congressman Greg Murphy, who is a congressman from the 3rd District in North Carolina, which is the eastern part of North Carolina, is a practicing urologist, the only practicing physician in Congress. There are physicians in Congress, but they're not taking care of patients. But he's a urologist. He's traveled all over the world treating people who are in under-resourced countries, and he's really a terrific guy. And he sees things the same way that I do, and we've done some joint op-eds, we just had one recently in the Wall Street Journal about this. And the Educate Act goal is to get DEI out of medical schools. And why do that? Why focus on DEI? Well, the issue is that DEI is simply the operating arm of identity politics. And that's really what it is. And I don't want to treat people, I don't want to look around the room and say, oh, you're in this group, you should be in that group, you should be in that, and I'm going to treat you differently because of the group you're in. And I think we've seen recently the fruits of this and the rise in anti-Semitism around the country. The Jews, I'm Jewish, we're being put in a group. We're being given characteristics of a group. We're not being treated as individuals. There are Jews that hate what's going on in Israel. There are Jews that are completely supportive of what's going on in Israel. There are people in the middle. Everybody should be treated individually. And what we've seen on college campuses, and to a certain extent now, if you've seen what's happened at UCLA on medical school campuses, is people have been put in these groups, and we think this is terrible. We think patients shouldn't be put in such groups, and we don't think physicians should be put in such groups because we need to treat everybody as an individual. This is the American creed. This is what we believe in, and this is what we're really pushing for. So the Educate Act will try to get diversity, equity, and inclusion out of medical school and replace it with a focus on the individual. Anybody who shows up and wants to be admitted to the medical school, they should get in because they're qualified to get into medical school and for no other reason. And they shouldn't get in and they shouldn't be given a leg up. And interestingly, I had a chance to testify in front of Congress, and one of the individuals who ran that committee, and it was the same committee that interviewed the college presidents in that famous encounter that went on about context. You may remember that. And it was Burgess Owens, who is a terrific guy. He's a congressman from Utah. He was a professional football player with the Oakland Raiders, beat the Eagles in one Super Bowl, which was annoying. But Burgess Owens stands up there and says, "Don't insult me and tell me that I need a leg up. I'm perfectly capable of competing with anyone. I don't want this. It demeans what I've accomplished." And so our efforts have been to try to create legislation that supports that idea. And I'll just move ahead quickly and try to get to the end of this. The second thing we've done is we've sued people. Now, the reason we've sued people is because they've demonstrated discriminatory behavior in healthcare. Some examples of that. An organization called Health Affairs, which publishes a journal that considers itself kind of the key journal, and it is the key journal in health policy. And they had a fellowship that excluded whites and Asians. That was the description of the fellow. You wanted to be a fellow. There were a bunch of kinds of groups you could be in, but you couldn't be white and you couldn't be Asian if you wanted to qualify for this fellowship. Now, in fact, Health Affairs gets a lot of money from the federal government. Anyone who gets money from the federal government has to abide by the civil rights laws, which preclude this sort of thing. So we have gone around the country and we've sued a bunch of organizations. And I'll tell you just a little bit of detail about one lawsuit, which was against the state of Louisiana. Now, the state of Louisiana has a rule that if you're going to constitute the medical board for the state, every other appointee has to be a minority person. Now, again, this is completely illegal according to the United States laws. I was interviewed on NPR down in Louisiana, and I thought they were going to beat me up pretty well, but I said to them, they asked me, "Why do you object to this law?" And I said, "I object to it for two reasons. One is it's against the law, and I happen to be a law-abiding citizen. I don't like things that are against the law. The second thing is, let's say you're an African-American physician, highly respected in your community, one of the top physicians at your hospital. You get appointed to the state medical board, and everybody says, well, the reason they got appointed was they had to appoint a minority person to the medical board. You've just undermined the achievements of this individual, which is terrible. And a lot of my African-American friends feel the same way about this. They don't want to be told that their accomplishments are due to some sort of issue about quotas and what have you that have been created. So that's the second thing we've done. And we have a lot of lawsuits. We have about 140 times we've interacted with schools that have so-called scholarships. They're mostly visiting fellowships for students that are thinking about their residency program and are trying to be attracted to one school or another. And again, they say, no, we don't want any white students. We only want minorities to come here. And we're not going to, if a white student, comes from a rural environment, is poor, cannot afford the trip just like anybody else, they're not entitled to this, which again, this is un-American. The third thing we've tried to do is to inform the public, and that's why I'm here. And there are a lot of organizations that are trying to do that. And what are we trying to inform the public about? Well, it's one thing to just, this is the way what Stan Goldfarb believes in. Nobody really cares about that. What we have to show them is what's really going on, and that's where you all come in. Because one of the great things that we've been able to do is to have individuals at various institutions around the country who have become our sources for what's really going on today in their institution, what's undermining the sort of approach that I think most of the people in this room here would favor at their institution, which is to treat everybody as an individual, not to have compelled speech, not to force faculty members to sign DEI oaths when they're going to get in front of a promotions committee, not to ask students when they apply to medical school, what have you done to satisfy our need to have community advocates? What if you don't want to be a community advocate? What if you're worried about molecular biology and what all you're interested in is creating the next kind of chimeric T antigen cell that's going to cure pancreatic cancer. What if that's your goal and you don't care about those other things? You're not eligible because you're not interested in those kinds of issues. You ought to not be compelled to speak about anything in the United States. You ought to be a free person who can speak your mind as long as you don't threaten people and as long as you don't create public disruptions. So one of the reasons we're here is we want you all to join us. And we want you all, there's no cost, we don't expect donations or anything like that. What we want, we're very fortunate because we have wonderful donors, mostly like-minded people who think these are important issues. They're both physicians and other people that have become very wealthy in this wonderful country of ours and are interested in seeing these kinds of ideals pursued. So we really want you to come to the donoharmmedicine.org website and to sign up. And then when you encounter things that bother you, we are there for you. We have students that we've produced their legal representation when they've gotten into difficulty, and we have the resources to be able to do that. That's a rare event. Mostly we've had students who have come to us and said, look, this is what's going on in the school. This is what's really bothering me. Again, UCLA has been the great example of it. This person who gave us a talk at UCLA who asked the students, this is in their equivalent of a doctoring course. It's called Anti-Racism and Health Equity course. This woman stood in front of the audience and made the students recite a prayer to Mother Earth. So if you're a Catholic or you're a practicing Jew or you're someone who has a strong faith, you're not going to pray to pagan gods. I mean, that's not what you want to do. And yet this woman was up there, and if the students didn't participate, that was looked upon poorly by their school. That's totally unacceptable. But that's what's gone on at UCLA. We've been told recently by a student at UCLA that they had a lecture. These two psych residents came and gave them a lecture where they extolled the actions of that unfortunate man who self-immolated over the Palestinian-Israeli conflict. Now, however you feel about that conflict, burning yourself doesn't seem to make sense. And yet, these psychiatry residents were arguing for it. And again, the students were very upset about this. They told us this. So what's the benefit of informing the public? The benefit of informing the public is then we can both embarrass the school, which usually has an effect, and also get people like their donors, like their supervisors and all, to be riled up about this and to start looking for reform, which is what we're really after. So this is how we're hoping to reform medical education through legal efforts. Right now, Congressman Murphy has about 60 congressmen who are behind this, and we're looking for much more, and we're pushing the House through our lobbying efforts to come on board with this law, the EDUCATE Act, through legal efforts when we identify problems where students or faculty are being acted upon in a way that's really un-American and illegal. We're working for them. And thirdly, by informing the public. So we're really hoping that you will join with us. And I'm going to stop now, see if you have some questions that you'd like to ask, and then we'll be delighted to see you at lunch, which we're providing.
Sure.
Thank you.
Is this on? Yeah. I was just wondering, how much momentum do you have compared to the forces you're opposing?
Oh, well, it's a good question. This is a struggle for kind of the soul of America. And we don't see this as a short-term problem. We see this as a long-term problem. But I think we have a lot of momentum. I think if you go back 3 years ago, there was no pushback against any of this. This was the Wild West when it came to, and I don't know what you've encountered in your schools, and there's quite a bit of heterogeneity around schools. One little anecdote, so I was at a scholarship dinner for Jefferson Medical School, which has not played up these issues as much as other schools have. And I sat with some students. I'm on a foundation that has given out scholarships, not my money, but a wonderful foundation that's able to do that. And this young woman, who was really terrific young woman, and she said, no, we have a course that's not much. She said, but I have to tell you that I have two very close friends and myself. we were at the top of our classes in college, went to very competitive schools, and we didn't get into med school last year. And, and I know UCLA Medical School, for example, is one that apparently there are 2 Jewish students in a class of 160-something medical students. Now, there shouldn't be more Jews than anybody else. I mean, there's no particular reason, but it used to be about 50% Jewish students. Things are going on here where these identity groups are being favored one over another. There was a paper that appeared in the radiology literature just today, just identified by another source, someone at a school, not a student, but a faculty member, that in radiology residencies, if you were a Republican, if you said you were a Republican, you had a 0.6 chance of getting a residency compared to if you weren't a Republican. So the R value was 0.6 compared to that. So there you go. So there's an example of sort of just a bias against people for their thinking, which is against it. So do we have momentum? I think we do. I think we have Congress, passing a law about this. 3 years ago, that would have been unheard of. So I think we've made some impact in the last few years, but we'll see. And we see this as a long fight and something that we're going to treat as a marathon.
Thank you so much for your presentation. I finished medical school about 20 years ago, so I've been out for a bit. And obviously, the environment has changed a lot. And for myself, as I watch societally all of these different stressors and movements come to pass, I wonder, where does this come from? What's the source? And so as I've tried to figure that out myself, I've read certain authors like James Lindsay and Christopher Rufo, if you followed them, and they do a really good job of tracing this ideology back through the decades to Marxist ideologies and postmodernism. And I know all of you don't really have time to be doing a lot of reading on those topics, but could you address what you see with that correlation?
Yeah. So this has been, what are the roots of all this? Everybody's really quite interested in it, and I quite agree. I think the best book I've read about this, which I urge on you because it's very clearly written about the origins and about the problem, is something called The Identity Trap by Yascha Mounk. Now, Mounk is a man of the left, and he's a professor of political science at Johns Hopkins. And in fact, do no harm, we have a podcast that we have that's out there. We just did a podcast with Yascha Mounk, and I asked him specifically about this to inform the audience. And it is this postmodern thinking that, everything is, there really is no reality, everything is constructed. And then some of the work of people like Derek Hall, who was a Harvard social scientist, maybe a law professor there, who felt like the civil rights laws were a bunch of crap and that blacks in this country continue to be an oppressed group. There's no such a thing as people rising up above the oppressor, oppressed kind of mentality. And that mentality, which comes out of postmodernism, that the whole world is based on power structures between the people who have power and the people who don't. And once you accept that ideology about the way the world is constructed, the way social interactions go, almost everything else follows. So anybody who is decided to be oppressed, they can do no wrong, and they have to be lifted up. And anyone who's an oppressor can do no right, and they have to be knocked down. It's interesting about Jews. We used to be oppressed, but now we're the oppressor. So you can decide which thing is more comfortable for you. A lot of my colleagues have said, what we need to have is DEI also extended to Jewish people. And I say, no, the problem is to get rid of DEI. DEI is the problem. DEI is not the solution. The solution is to treat everybody as individuals and not assume group characteristics for anyone. So the story is much more complex and longer than that, but I recommend the Mounk book. It's really excellent. It's pretty short, about 250, 300 pages, and it's very clearly written. Sir.
Here, Scott. Go ahead. We have time for one.
Thank you for coming here today. We appreciate your you being here. I just had a question in regards to kind of where your position is on DEI, because a lot of schools have DEI boards and chairs and all of these groups, and is there any data or any kind of like studies you could point to in order to that kind of help to inform your position, or that could maybe shed more light into the space? Because on both sides, I feel like there is a lot of there are a lot of statements, but there's sometimes not a lot of like clear data to back up either side's point necessarily. It's more
Sure.
so about the social context that people are viewing things through. So I just want to know if there are certain sources that can maybe we can maybe look at in order to.
Yeah, that's a very good question and a very fair one. So the question is, how do you support your positions? Let me sort of turn it the other way and say, what's the support for the diversity position? What's the argument that we absolutely have to have more, particularly black physicians, to care for black patients? The AAMC says this is the case, that the only way we're going to improve health disparities, which are definitely real phenomena and need to be improved, is to have more black physicians. That's the rationale. Our organization has done a study of this. We have two social scientists, Jay Green, who's at the Heritage Foundation, former chair of a department at University of Arkansas, Department of Health, of Education Research, and Ian Kingsbury, both PhD scientists. They reviewed the literature of racial concordance. And there are 5 systematic reviews of this issue. 4 of the systematic reviews demonstrate that there's either no benefit or, in fact, in certain cases, worse outcomes if black doctors have if black patients have black doctors. Now, mostly the literature says it doesn't matter, and that's not surprising. And if you're a minority person, what you're really interested in is getting better, right? That's the most important thing. And the idea, well, I can communicate better with this person, not what the data says. And how are the data generated? They're generated, and it's over 60 studies that make up these 5 systematic reviews. They study by questionnaires afterwards, by observations. So what the medical organizations have done is pick, for example, about communication. There are 6 studies that show a benefit, 8 studies that show a worsening communication if there's racial concordance, and about 26 studies that show no effect. They pick one of the 6 studies and say this is an important reason to change the way we admit people to medical school. So I would sort of turn the question around a little bit. What's the argument to go in that direction, to say that we have to have 15% of the physician workforce have to be black physicians, or, and particularly given that the black community is so heterogeneous. There are people from the Caribbean, people from Africa in their origins, people from all over the world. And so what are you really asking for here, other than sort of categorizing people as black or categorizing people as brown or whatever skin color you decide that's important? What's the evidence that that's going to benefit anyone? And without that evidence, to sort of change the criteria for entry into medical school, for example, or promoting people into a scientific laboratory or into a professorship in a medical school, what's the logic of that? So I sort of turn the question around. But I think this is an ongoing, important question to ask. You're absolutely right. The other thing I would say about the social conditions that lead to poor health, it's really hard for anybody to identify what the link is. There's no question it's bad to be poor. But is it worse to be poor with one skin color versus to be poor with another skin color? Does that change the characteristics of health outcomes? And that's really very unclear. Maternal mortality is an important issue that we've looked at carefully as well. I've written about it, and our organization has looked at it very carefully. Black women have I'm not just looking at, I'm looking at you to have this conversation, but it's not just your problem because you're black. It's the problem is for everybody in this room. And maternal mortality is much worse for black women. And why is that? Well, one of the biggest reasons is that black women have a 40% lower rate of getting first trimester care than white women do. So immediately, if they're hypertensive, the problem is not going to be dealt with immediately. It's going to persist into the later stages of pregnancy. Secondly, there are genetic factors. Now, the particular genetic factor is a gene that derives from West Africa, or many African Americans in this country have ancestry in West Africa where they were enslaved and brought here. And that gene protects against African sleeping sickness. If you have that gene, just like sickle cell gene protects against malaria, this gene protects against Africans. It's a variant of a gene that's an important gene, but a variant of it. But that gene, if you take it and transmit it into experimental animals, they get kidney disease. So part of the increased risk of kidney disease in the African American population is a genetic thing. If women have one of the variants of that gene, as a haplotype, they have a higher risk of having prematurity because they tend to have more hypertension and they tend to have worse pregnancy. So the reasons for the outcome of poor outcomes for black women who are pregnant is very complex, and it cannot be solved by saying, I'm going to send everybody in this room to implicit bias training. That's not going to fix things. What we need is better outreach, and that's quite clear. And our organization advocates very much for better health access. Sometimes that goes against Republican ideas of how health care ought to be provided by the government. But we feel very strongly that this is an outreach and health access problem on both sides of the coin. The patients need to access the healthcare system earlier, and the healthcare system needs to make itself more easily available, affordable for the population, particularly the ones that have had poor health outcomes. So it's a very complicated, very important question. We continue to look at it, but I think that the data are interesting and need to be further studied.
Yeah. Yes, I work for an academic institution in the state of Texas, and our governor in Texas, I don't know where this or not, abolished all DEI efforts at all state institutions of higher education and learning. The main University of Texas branch had to abolish this department of like 60-some people, which shows you how entrenched all of this has become. I don't know if your organization was involved in that or not, but if so, I thank you for that. But I think a parallel issue, I think, of concern that's coming up is this whole concept of professionalism. And I think that's another aspect of cultural Marxism. And so obviously someone's going to define what a professional is, what you or I are supposed to be as a professional, and what we can't be. I think that's something else we need to keep a close eye on.
Well, thank you for that comment. You know, there's a lot about medicine that needs tending to. We're looking at one aspect of it. There certainly are others. And you know, I mean, I've loved medicine. I was a practicing doctor and a researcher for over 50 years. What really motivates me is I don't want to see it decline. I don't want to see it become something where patients are divided from their physicians, which is another argument against racial concordance. You know, I remember we had a lady who came into Hospital University of Pennsylvania, and she didn't want a black person to come into her room. And you know what I said to her? I said, you know, you got to find another hospital if that's the way you feel. That's just totally unacceptable. I don't want black people coming in saying, I don't want any white people in. I don't want any of that. That's not the America that I grew up in, an America like that. When I was alive, and I went on a high school trip to Virginia from Brooklyn, where I grew up, and we went and saw these segregated bathrooms. I was shocked. I couldn't imagine, what the hell are they doing here? I don't want to go back to a country that has that ethic. That was just terrible, and we need to get away from it. Yes.
So back to the medical student situation, I feel like, and I'm wondering if you would share this with me, I feel like doing things in medical school, like requiring DPI, requiring the pronoun use, whatever, I feel like it's bordering on criminal because you're taking a vulnerable population who is essentially a prisoner during that time frame. We're in medical school. So you take that vulnerable population and you're exploiting that vulnerability. And I believe, and that my mother instinct comes in, I believe that borders on criminal behavior for the schools and for the people that participate in the future. Medical students are golden hearted and they're trying to do something remarkable and you're supporting them. So I believe that borders on criminal laws on that.
And if they disagree, you're out.
Yeah.
You're socially canceled.
Well,
career.
yeah, and you know, I think, look, I don't know, I mean, criminality and is one thing. I think, you know, most schools have their code of conduct, and the code of conduct, you can't violate it as a student because you do get in trouble if you violate the code of conduct. So it depends what that code of conduct is. One of the concerns has been that the schools have not applied the code of conduct equally. Why can't you, you know, if you're saying something that's perfectly rational and under control and not disruptive of anything, why can't you have that point of view. So the point of view problem was what we saw on display with the college presidents in front of the congressional committee. You had to have one point. They allowed one point of view, but they didn't allow the other point of view. I lost my train of thought with that. But again, I think it's very important for us to hear about these issues. I mean, that's what I'm pleading for. If the students feel like they're under these kinds of constraints, and they are, certainly. I mean, and it's not going to go away. When you're a third-year student, you're not going to want to speak out because you're worried about your residency plans. And when you're a first-year resident, you're not going to want to speak out because you're going to worry about whether you're going to get a chief residency. And when you're a chief resident, you're not going to want to speak out because you're worried about, are they going to send bad letters to the practices that you want to join or the new institutions you want to go to. So it's a real problem, and that's why I think we need to get rid of this idea that there's only one way to think about the world in medical school. There ought to be lots of ways to think about the world. There may be people that are totally focused on population health and the issues of DEI, and that's great. They have a perfect right to that, but it's not to be imposed upon them. It's not to be imposed upon the entire school.
All right, everybody. We are going to make
One more quick question. Quick one.
Guys,
I know. See what she's.
yeah.
Anyway, what you're talking about, since we're in a room full of medical students, I was on faculty at OU called pharmacy. I turned in almost 3.5 years ago my DEI training, which I thought was a mistake pronoun to the instructor she made. And it really is not incumbent on the medical student. I think it should be incumbent on the faculty to band together and push back and say, no, we're not going to do this. Now, unfortunately, it did not end well for me, but at least I brought it to the attention of the Board of Regents, and I said, I feel like my civil rights have been violated here with this training. They did agree with me on that training, but what happens is that your DEI departments recycle it and spit it out with new words and new vocabulary. So my question is touching on that and what this other student was asking. Heather McDonald wrote a beautiful book called The Diversity Delusion. And I look at that as kind of like the Bible. You're probably familiar with her.
Yes.
Why, to answer his question, the Harvard Business Review, July, August of 2016, did a review on corporations, 830 of them that they studied over 3 decades. Does implicit bias training work? No. What does it do? It creates a fracture and ruins the company. So that one is really good to have in your back pocket. My question is for you, Dr. Goldfarb. Where have you seen success in where you've gone into like medical schools?
So just to finish, sorry to cut you off, but we have seen Oklahoma. Your governor declared no more DEI here, right? Yeah. So we're looking at that, and we're studying that issue of how they're trying to get around some of these issues. Let me just finish very quickly and just say because a message I want to get to the students. If you really are feeling under the gun, you should contact us. I wouldn't urge you to speak out on your own. I think it's a real problem. I've been asked about this a lot of times. I think it's dangerous for students to speak out at this point. I think it's important for them to get advice and to get support. We'll put you in touch with lawyers, and if your particular situation requires legal stuff, we'll give you some advice and we'll give you some backing. So that's another reason to join us, because we really are interested in supporting you. We have a bunch of students now that we're supporting. Yes. Our organization, the goal of having a membership organization, so these lawsuits that we put on, the individual can be anonymous. This issue is being tested in the courts right now based on our efforts, but we certainly have maintained anonymity completely. But I should warn you that schools will do things like insert some code in every email they send out to you, so that if that email appears someplace else, they'll find out that, in fact, you had sent it. So first you should contact us by phone. We should talk about things before you start emailing us back and forth, which can really lead to problems. So assume the worst about your institution. That usually is a good way to proceed. Yeah, yes. All right, well, thank you all so much. I really appreciate it.